Hello, my name is Katalina Garcia, and this is my educational presentation on vasopressin and oxytocin. So just a quick layout of this mini educational presentation. We will first cover a general overview of vasopressin and oxytocin, the systems that they're in, and then we will look at oxytocin in research specifically. So first we have vasopressin. Vasopressin is an antidiuretic hormone, ADH. It has two major effects that correspond to it. The first effect that we see is that it conserves water during urine formation by the kidney nephrons. That is the antidiuretic effect. And then its second main function is that it causes contraction of the anteriolar smooth muscle, which is the vasopressor effect. So under normal conditions, vasopressins are the primary endocrine factor that regulates urinary water loss and then the overall water balance. In contrast, we have typical levels of vasopressin play only a minor role in regulating blood pressure by means of promoting arterial vasoconstriction. And here we have this picture which just shows vasopressin and oxytocin, but we will dissect this picture later on after we go into oxytocin. So again, vasopressin has two main functions. It conserves water during urine formation by the kidney nephrons, and then it causes a contraction of the arteriolar smooth muscle. So those are the two functions of vasopressin. Then we have oxytocin. Oxytocin is a peptide hormone. It is produced by the hypothalamus, stored in the posterior pituitary. It's released from the posterior pituitary into the blood via the hypothalamus from nerve stimulation from the hypothalamus. It is a powerful uterine muscle stimulant. Oxytocin also plays a very impressive role in the progression of labor. This hormone was once actually discounted as a trigger for parturition because of the circulating levels of oxytocin that remain constant before the onset of labor. So this picture here, we can just see what I explained, that the hypothalamus, you can see as it connects to the pituitary gland, and how oxytocin is produced by the hypothalamus but stored in the posterior pituitary, where it stays until it is released to the blood via nerve stimulation from the hypothalamus. So the pituitary will not release oxytocin until the hypothalamus alerts the pituitary gland to release it. As I said earlier, oxytocin plays a key role in the progression of labor, as well as acts as a powerful uterine muscle stimulant. So again, going into this picture, we have, you can see here oxytocin being diffused. We see that neurons release oxytocin into the bloodstream, as I stated, the posterior pituitary, anterior pituitary, and then the hypothalamus here. So continuing on, going back to this picture, again, I showed this picture when we were looking at vasopressin. Here we could just see how there's this breakdown of, in the posterior pituitary, there's vasopressin and oxytocin being housed, although we know that it is being created in the hypothalamus, which we see up here. So here, let's just go down this. We have oxytocin, which is affecting on the uterus and the mammary glands. And then we have here vasopressin from the posterior pituitary, affecting nephrons in the kidneys as well as arterioles throughout the body. And so the posterior pituitary releases these hormones into the bloodstream, but will not do this unless activated via nerve stimulation from the hypothalamus. So although it is being housed in the posterior pituitary, the hypothalamus is very much in control of the secretion of these hormones. So in oxytocin, let's go back. The uterus, its effect on the uterus is that it stimulates uterine contractions. And then on the mammary glands, we see that it stimulates milk ejection during breastfeeding. And so if you remember earlier, I stated that oxytocin plays primary roles in the progression of labor, but not only labor, but the body after labor occurs. So very much so the milk production and ejection during breastfeeding. Going back to vasopressin, its effect on the nephrons in the kidney is that it increases permeability of distal and collecting tubules to water. Next, in the arterioles throughout the body, the effect on the arterioles throughout the body is that it causes vasoconstriction, which I did state earlier. So again, oxytocin vasopressin, stored in the posterior pituitary, but controlled by the hypothalamus, because the posterior pituitary will not send out these hormones into the bloodstream unless enacted upon by the hypothalamus, as with many other hormones. So specifically going into oxytocin and research, this research article is looking at to assess the effects of maternal, fetal, neonatal outcomes of tocolysis with ORA, which are oxytocin receptor antagonists, upon women with preterm labor. And they're comparing the findings here compared to various other tocolytic agents as well as a placebo. So a little background on this research. First, preterm birth, which is defined as 20 to 36 completed weeks, is a major contributor to prenatal morbidity and mortality globally. Oxytocin receptor antagonists, which are our ORAs, such as atosyben, have been specially developed for the treatment of preterm labor. ORA have been proposed as effective tocolytic agents for women in preterm labor to prolong the pregnancy with fewer side effects than other tocolytic agents. So basically here, the researchers are looking on how to help mothers that are projected to have preterm births to hold the pregnancy longer via tocolytic agents. So the researchers are looking at the use of oxytocin receptor antagonists in women who are projected to have preterm labor and comparing that to other tocolytic agents as well as a placebo. And here are our findings. Oh, well, first, actually, the research methods. This research looked at a total of 2,485 women with preterm labor. Sorry, my mind went blank. So the selection criteria was for anyone in labor between 20 to 36 weeks gestation. The research demonstrated superiority of the ORAs, which the research led to look at, as a tocolytic agent compared to the placebo. And here in this picture, we see that oxytocin receptor antagonists, which are our ORAs, compared with other tocolytic agents by the type of other tocolytic agent. So statistically, first we see that the ORA versus the beta mimetics, which is this first one here, and then we see the ORA compared to CCB, which is the calcium channel blockers, which are other tocolytics. So the researchers did not find a superiority of the atosyben, which is their ORA that they were researching as a tocolytic agent, compared with the placebo or the beta mimetics or the CCB, which is what this figure here is showing. So the researchers did not find a statistically significant improvement of the ORA atosyben compared to the tocolytic agents that it was being compared to, or the placebo. So in terms of pregnancy prolongation or neonatal outcomes, although the ORA atosyben was associated with less maternal adverse effects than the treatments of the beta mimetics or the calcium channel blockers, there was no statistically significant prolongation of pregnancies. So researchers looked at the oxytocin receptor antagonists as solutions, as aids in the prolongation of pregnancy with less adverse effects than other tocolytic agents, but we're unable to find a statistically significant better approach. So, as a review, we went over vasopressin, which we know works to conserve water during urine formation, as well as cause constriction of the arteriolar smooth muscle. We looked at oxytocin, which we know is a strong uterine muscle stimulant, as well as playing a big role in labor progression, such as stimulation of milk during breastfeeding and other labor effects. And in research, we see that oxytocin receptor antagonists are being researched and used as labor prolongation because of oxytocin's use and function on the body for labor, such as milk production. So we can see this, how oxytocin is being used in research today. And again, these two hormones are stored in the posterior pituitary, but released into the bloodstream via the hypothalamus stimulation, nervous stimulation on the posterior pituitary. Again, here are my references. Here is my research article, and then the picture I used, and then the textbook I used for the background information. And again, my name is Katalina Garcia, and this was my presentation. Thank you so very much.